Hello, it is super nice to see you. My name is Lee and I'm a medical assistant that's going to be getting your vital signs and your history. It looks like you're a routine patient just coming in for your yearly Pap smear, and there's also a note in here saying that you wanted some STI screening. Would that be correct? All right. And did you want it with blood work as well? That includes the hepatitis, syphilis, and HIV. Lovely. All right. Any new changes to medical history, surgeries? Okay. And are you taking iron? As far as family history, any changes since we last saw you? No? Okay. And then are you in that same relationship? All right. And no new history of infection from down below? Gotcha. All right. I can't believe it's already been a full year. All right. Well, let me just do your temperature check and your blood pressure check. Remind me about how tall you are. All right, awesome, awesome. Let me just get this going. This was a funny story, let me tell you. So I was trying to be domesticated and I was using a mandolin for the first time. And I was loving this mandolin. I'm like, wow, it is so easy to cut onions, right? Yeah, well, I don't know what happened, but as I was moving with the onion thing, my finger went with it. So like the whole chunk here is gone. It's missing. It took about 5 hours to stop the bleeding, but you best believe I stopped it while at home because there was no way I was gonna get a hospital bill. Yeah, it's kind of funny hearing that from you, right? Yes. I'm just grateful that it stopped bleeding eventually, but I'm also grateful that it didn't hit a nerve or anything like that, so not too serious, you know? Right, I'm just scared to see how it's going to heal because I am known to not be a good healer. But work's been interesting with this, to say the least. I should mention, Lena the PA has the same wound. All right, if you wouldn't mind lifting your tongue up here, just doing the temp check. I feel like the music is a bit louder today, which is quite distracting. But it'll get your mind off of the Pap smear, so that's always a plus. All right, temperature is good. Let me cover this up here. We'll get your blood pressure. Remind me, are you on any forms of birth control right now? Okay. When did you stop those? Thank you, thank you. All right. Let's get the blood pressure cuff going. But yeah, the new season of You is coming up. I'm super pumped for that. Yes, I've waited way too long. I'm gonna wrap this around your arm here. Does that feel pretty snug? Good. All right, let me put the stethoscope on. Okay. All right, your blood pressure is looking good. So yeah, anything new with you? Don't mind me. I feel like I was just telling you my whole life story recently. But you've been doing okay otherwise. Awesome. We love to hear that. Let me just put your blood pressure reading in. Oh, 124/80. Sorry, probably should have mentioned that. All right. So the plan is then I, of course, will step out and give you some privacy. we have your white drape here that you're going to use. You can keep your top on, just take off your bra for the routine breast exam. She'll press on your abdomen, make sure she doesn't feel any masses or tenderness. And then we'll do the pelvic exam, the pap smear, which is the cervical cancer screening. And then we'll do an STI swab for gonorrhea, chlamydia, and trichomonas. And then we'll do the blood work. I'll actually come in for the blood work at the very end. Yes, that's a new skill that I'm starting to do. So I actually will be able to see you after you see Leanna the PA. So that's fun. So you're familiar with all the equipment, right? You don't need me to kind of show you and explain. I feel like we did that previously. Yes, no problem. Okay, so let me stop talking. I'm going to give you some privacy, and Leanna the PA will be in to do the exam portion. Absolutely, it is my pleasure. I absolutely love seeing you, and I will be seeing you after the visit to do the blood work. Sorry, I'll try not to act too excited. I know most people aren't. All right, I'll see you soon. All right. Hello, nice to see you. I'm sure you remember me from last time, but my name is Leanna, and I'm the PA that will be doing your exam. Lee, the medical assistant, was telling me that we're going to get full STI labs today as well. So we will do that after, of course, the physical. But are you having symptoms? Are you having concerns from down below? Or everything seems pretty routine? Pretty routine. All right, awesome. Well, let me put some gloves on, and we're going to get started with the breast exam first. Are you comfortable with that? Awesome, awesome, awesome. All right, so if you wouldn't mind, I'm just going to adjust your drape over here. And if you wouldn't mind lifting this arm up a little bit by your head, you're going to feel my hands just doing the exam. But you've been okay? Awesome. No tenderness when I press here, right? Good. And you do self-breast exams at home? Awesome. Yep, we recommend that once a month. Just kind of what they call breast self-awareness. I'm going to come over to your other side. All right, and then I'm just going to lift this a little bit to the side here. You'll feel my hands. And if you could just adjust your arm again. Perfect. Both sides look pretty symmetrical. And no tenderness with this breast either, right? Good. Press a little bit here. No nipple discharge. Great. I am just going to press on your belly. And no tenderness. Awesome. Not seeing any masses. Going to do a little bit of percussions. Very good. And no burning when you pee? Good to hear. Let me get you covered back up then. As far as the breast and abdominal exam, everything looks super healthy. So what we're going to do then is I'm going to ask you if you can scoot your bottom all the way to the edge. You're almost going to feel like your bottom's hanging off, and that's how you know you're in the right spot. And then we'll get all set up for the pelvic exam. Yes, all right. So let's kind of get you situated. Alrighty, it looks like you're in the right position. Do you feel comfortable? Do you feel like anything is bothering you with where you're laying right now? You're good? Awesome. So we are going to start as always with an external assessment where you look on the outside and make sure I don't see any moles or lesions or anything that maybe you're unable to see given where it's located. So you're just going to feel my hands here, and you of course let me know if you get uncomfortable during any part of this. Just going to feel my hands. Right, I don't see any suspicious moles. External exam is within normal limits. The next part of the examination is with the speculum. Today we will be starting with a small size speculum, and of course if I have to go longer based off of your anatomy, I will let you know. Yes, exactly. So we insert the speculum to see the cervix, and then we use these two brushes here for the Pap test or the cervical cancer screening. Yes, these are the two Pap brushes. Do you see them? Yep, this is what we call a spatula, and this one here has like soft bristly features, and that's called a cyto brush. Yes, exactly. So let me get the warm water started so we can heat the speculum up. You're going to feel, just pressure here, you're going to feel on my hands there again. You're going to feel some internal pressure. Take a deep breath in. Perfect. You're doing great. I see your cervix. Let's get this Pap smear over with for you here. Going to take our two brushes. Going to feel the first one maybe. Sample collected with that first brush. Then we'll take the spatula. Done. Let me mix these two things together. Perfect. We're going to take our vaginal swab sample. You'll feel another swab. It's been collected, and those will all get sent to the lab. With that being said, everything looks super healthy, no polyps, lesions, or abnormal discharge. I am going to take the speculum out. Perfect. You feeling okay? You did fantastic. I tried making that go as fast as possible. The last part, if it's okay with you, is an internal assessment with my glove. I'm going to put some lubricant on it, so if anything, you'll probably feel like that colder lube. Yes, exactly. All right, you're going to feel some internal pressure. Any pain when I do that? Good, good, good. All right, very good. You're all set with your exam. Now, the one thing that I did notice is it looks like you may be starting your period soon. No, that is absolutely okay. There was barely any blood on the inside. Let me grab you some stuff. All right. Would you prefer tampon, pad? A pad? All right, I will give that to you. Seriously, it's no problem at all. So let me cover you up here. I am going to give you some privacy. We'll have you get dressed. The Pap usually takes about a week to come back, and I will call you if anything is not normal. As far as the STI swab goes, those results you'll see in your chart within the next couple days. I know you wanted blood work as well, and Lee, the medical assistant, is now trained in doing blood draws, so she's going to come in and hang out with you, get that blood work done, and those results you'll probably see within 24 hours. Yes, absolutely. No, it was my pleasure. I'm going to give you some privacy to get dressed, and then Lee, the medical assistant, will be in to get your blood work going, and then you will be all set for the year. Yes, of course, unless you need to come in sooner for any other concerns. But let me give you some privacy, and Lee, the medical assistant, will be in. It was awesome seeing you. My pleasure, my pleasure. We'll see ya. Alrighty, are we ready to get your blood work over with? Awesome, awesome. And what arm would you prefer we get the blood draw from? No problem. I can absolutely do that for you. Your Pap go okay? Good, good. Yeah, it usually goes by a lot faster than people think, for sure. Alrighty. So what we're gonna do is, can I just see that arm here? Okay, awesome. So I'm just gonna prep the area. Things are always a little bit harder when you don't have a functioning dominant thumb, but that is okay. Okay, let me just clean this for you. Oh, I'm not that new at this. Trust me, I'm a professional. I got you. You trust me, don't you? You do. You do. We got this. You have easy veins. It's a very big compliment. Make sure you are all sanitized. All right, wait for that to dry a little. Alrighty, let's get your arm wrapped up here. Give me a second. Alright, gonna wrap this arm to kind of make it tighter. Okay, gonna make sure we can feel that vein pretty easily. Awesome. Alright, you ready to get this over with? You don't feel like you're gonna pass out, do you? Okay. Alright, and quick poke. 3, 2. You're doing awesome. Good job. Now, this blood work will be for hepatitis, syphilis, and HIV. The only thing that you will not be getting screened for infection-wise is herpes simplex virus, as you are not having an active outbreak, nor are you high risk. So that's kind of more of a FYI. I'm going to hold it down there. I'm going to put a cover pad there. I'm going to keep some pressure on it to reduce bruising. Alright, I'm going to take this bandage here. Let's kind of place that on you there. I'm going to unhook the wrap. You are doing awesome, awesome. Okay, let's add a little bit of some tape just to hold everything in place here. Wasn't too bad, right? That in place. I'm gonna just kind of wrap it all up. Perfect. All right, still feeling good? Maybe want a cold washcloth? No problem. Alright, place this on your forehead here. You're amazing. You're gonna do good. If you want, I'm actually gonna go bring you some water too. I want you to stay laying down for me though, since you just had your blood drawn. I know some people can kind of make them feel a little lightheaded or queasy. So I'm just going to kind of clean up the station here, and then you keep laying back, keep that cloth on your head. I'll go grab you some water, but other than that, you should be all set today. I know Lee, the medical assistant, told you when you're expecting your labs back, and of course she'll give you a call if anything is not normal. But do you have any questions for me, or do you need anything else? No? All right, well, it was lovely seeing you. Hopefully 2023 will bring us big new things. If you need anything, you just give me a call. Give Leanna, the PA, a call. Whichever. We're like 2 peas in a pod. Absolutely, absolutely. All right, I'll get out of your hair, but have a fantastic day. My pleasure. See ya.